Welcome to another episode of Uncovering Bailey in Love with Snazzy Surgeon.
All right, so we're going to jump right in today,
Let's get to it.
and we're going to be talking about a topic, sarcoma of the breast.
Right?
And this is a pretty interesting one.
Yeah, it is.
I think, every surgeon out there has run into this every now and then.
Yeah, it's like a little bit more rare than your typical breast cancer that we see,
Right.
but certainly something we need to be aware of.
Absolutely.
And keep in mind.
So when we're talking about sarcoma of the breast,
Yeah,
we're really talking about those primary sarcomas,
right.
the ones that are coming from the mesenchymal tissues of the breast.
Yeah, you got it.
So we're thinking about the supporting structures,
Yeah, all that structural stuff.
the connective tissue,
Exactly.
all that good stuff.
Stroma, all of that.
And there are two main subtypes, I think, that we really want to focus on in this deep dive.
Yeah, absolutely.
Fibrosarcoma
Yep.
and angiosarcoma.
That's the one we're all a little bit more scared of.
Oh, yeah, for sure. Yeah, that angiosarcoma can be tough.
So when you've got a patient coming in
Yeah.
and, they've got this unusual breast mass.
Right, and it's always that atypical presentation,
Yeah.
something a little bit different.
But what are some of the things that might make you think,
Uh,
oh, this could be a sarcoma?
hmm.
What are some of those red flags?
Well, I think one of the first things I always think about is their underlying genetics.
Right.
So, if you see somebody who's got a family history of Li-Fraumeni syndrome,
Oh, yeah. A big one.
or neurofibromatosis type 1, that's going to really send up some flares for you.
Absolutely. That's a huge red flag.
Yeah, and beyond just the genetic stuff,
Yeah.
it's really important to dig into that history,
Oh, yeah.
right? Have you had exposure to any sort of environmental things that we know are associated?
Absolutely. We're talking about alkylating agents,
Yeah.
vinyl chloride,
Uh-huh.
arsenic even.
Right.
I
Yeah.
mean, these are all things that can contribute.
So that's why, getting that good occupational history, oh, it's so important.
Detailed medical history.
Ew.
That's all super valuable here.
You got it.
And then there's another one that I think
Yeah.
a lot of us who've been doing this for a while have seen,
I know where you're going with this.
and that's prior radiotherapy.
Oh, absolutely.
So you see somebody who, let's say, was treated for Hodgkin's lymphoma
Classic example.
when they were younger,
Yeah.
and now they're developing a breast sarcoma in that field where they got the radiation.
The tough thing to see.
It's a tough one.
They've gone through so much already,
Yeah.
and then this pops up.
And we also have to think about chronic lymphedema.
Right.
We don't totally understand
We don't know exactly why,
the linkery.
but the association's there.
But it's there.
Yeah, if you've got somebody with long-standing lymphedema,
Yeah.
and then all of a sudden they develop a new mass,
You got to think about sarcoma.
it's on the differential for sure, even though it's rare.
It's got to be there.
Got to be there.
So let's talk a little bit more about angiosarcoma,
Okay.
because this is the one that
This is the one that keeps me up at night.
tends to be a lot more aggressive.
Oh, for sure. It's the most aggressive type of breast tumor.
And why is that?
I think a lot of it has to do with where it comes from.
Okay.
These tumors arise from the endothelial cells
Yeah.
that line the vascular or lymphatic channels
Inside the breast tissue.
right there in the breast.
So they're in those blood vessels and lymphatics.
Exactly.
And that just allows them to spread so much easier.
Oh, yeah. It contributes to their rapid growth and their potential for aggressive behavior.
And I think one thing that I've seen over and over again
Yeah.
is that connection back to prior radiotherapy with angiosarcoma.
It's like clockwork almost.
It's almost like you can just predict it.
Right. I mean, we're still trying to figure out exactly why.
Yeah, what's the mechanism?
But, the fact that it happens so often
Yeah,
and in that exact location where the radiation was given,
it makes you think.
it really does.
So if you've got a patient who's had radiation to the chest wall
Mm-hmm.
and they come in with a suspicious lesion,
Especially if it's grown quickly.
oh yeah,
Angiosarcoma's got to be at the top of your list.
gotta be.
Gotta be.
And the tough part is,
Yeah.
we all know this.
I know where you're going with
The
it.
prognosis with angiosarcoma,
Yeah.
it's not great.
It's a lot worse than other breast cancers,
It can be really hard to treat effectively.
especially if it's already spread.
Yeah, once it's progressed.
So you're really behind the eight ball at that point.
So, when you're talking to patients about treatment options,
Absolutely.
you really have to be upfront with them
You got to be honest.
about the challenges.
It's a tough conversation.
It is.
But early detection is key.
Yeah, the earlier the better.
Even then, it can be tough.
Yeah, angiosarcoma just has a way of
It's a fighter.
fighting back.
Yeah.
So I think what we've really highlighted here
Yeah.
is that these sarcomas of the breast, especially that angiosarcoma,
Especially the angiosarcoma.
it's a whole different beast.
They just require a different level of thinking.
Absolutely. You got to be on your toes.
You got to be thinking about the risk factors.
Yeah.
You got to be thinking about the unique clinical course.
It's not your average breast cancer.
It's not.
Not at all.
So what are some of the key takeaways that you want our listeners to walk away with?
Well, I think the most important thing is to just keep a broad differential.
Yeah.
When you're looking at any breast lesion,
Don't get tunnel vision.
don't jump to conclusions.
Think about those zebras.
Think about those zebras. Absolutely.
So those genetic syndromes,
Yeah.
environmental exposures,
Mhm.
history of radiation,
Big word.
chronic lymphedema.
You got it.
You got to be thinking about those things.
Absolutely.
Because if you don't,
You could miss it.
you could miss it.
And that could really impact your patient's outcome.
Exactly.
So keep an open mind.
Keep that differential broad.
And be ready for anything. All right. Well, this has been a great deep dive.
It has been.
Really appreciate your insights.
Glad to be here.
Thank you for listening to our podcast. See you in the next episode.